Hello, and welcome to the Hidden Health Code, where we explore the intersection of psychology, neuroscience, and health. My name is Tanika, and today we're tackling a topic that hits close to home for many of us: the connection between trauma and chronic health conditions. Trauma has been linked to a surprising range of chronic illnesses. We're talking autoimmune diseases like Crohn's and lupus, to diabetes, chronic pain, cardiovascular issues, and more. We'll explore how trauma might be playing a hidden role in these conditions and what the science says we can do about it. But before we delve into the science, I want to share a bit about my own story. Starting from my teenage years, I've been on a long journey with multiple chronic health conditions, including Crohn's disease, Hashimoto's, PCOS, vulvodynia, and on the mental health side, depression and anxiety. I was frustrated with having no clear reason or explanation as to why I ended up with so many health problems, particularly with the two autoimmune diseases. My parents were healthy, so I didn't think it could just be genetics, and I was always good with my diet and exercise. So the idea that my own body was attacking itself for some unknown reason wasn't really good enough for me, so I decided to explore it further to see if there could be something else going on and why so many of us have chronic conditions with no clear root cause. One of the avenues I've explored with this is the effect of trauma on the body. So I want to share some of these findings with you today to help uncover what might be one of the big factors behind it all. I also want to mention that I'm a very skeptical person when it comes to theories and findings around health. So everything I'll be covering in this episode and more generally in this podcast is founded in research from peer-reviewed journals. So let's get started. So firstly, what is trauma? At its core, trauma can be defined as anything that overwhelms our ability to cope. It's less about the event itself and more about how you experience it. It also helps to know the different forms that it can take. So Dr. Paul Conti, a psychiatrist and trauma expert, breaks it down into three main types. The first is acute trauma. This is probably what comes to mind when you think of trauma, those big life-altering events like a car accident, the sudden loss of a loved one, an assault, a war, or a natural disaster. It's those clear, dramatic moments where you can see a really obvious change in a person's state after it happens. The second form of trauma is chronic trauma. So unlike acute trauma, this isn't about one big event, but rather a series of experiences that add up over time, where you're constantly made to feel less than or different. Think of it as a slow burn, like dealing with ongoing racism, abuse, or bullying. Even feeling out of place in a new culture can trigger this type of trauma. For example, if you're an immigrant, even if you're well integrated into society and haven't directly experienced any racism, just seeing people who look, dress, or talk differently can make you feel unsafe or disconnected. Then there's vicarious trauma. Humans are naturally empathetic, and sometimes we absorb the trauma of others, almost as if it were our own. Do you ever watch the news or scroll through social media and feel completely drained or upset? That's vicarious trauma at work. Your brain starts to react as if the trauma was happening to you, even though you weren't directly involved. In fact, a 2015 study found that almost 25% of people who had no prior trauma reported traumatic stress symptoms, so vicarious trauma, after watching violent media coverage. But these three categories don't cover everything. Trauma can also come from missing experiences, or what we might call attachment trauma. This isn't about something bad happening, but about something good that didn't happen, like not getting enough love or attention as a child. For example, if a baby isn't picked up and comforted when they're crying, you wouldn't necessarily think of that as trauma, but for the baby, it can feel like a significant threat to their developing nervous system. The baby doesn't get the safety and comfort that they need, which can set the stage for a heightened stress response later in life. And then there's environmental trauma, where things like exposure to toxins, infections, or even mold can trigger a similar stress response in your body to psychological trauma. When I first learned about trauma, I didn't think I had experienced anything that could have a lasting impact. I hadn't been through abuse or war. But I realized that trauma isn't just about extreme dramatic events. It can be subtle, ongoing experiences that still affect your body and mind. So whether it's a major event, societal pressures, or unmet emotional needs, the impact is real and it shapes both our mental and physical health. So how does trauma actually impact your body? Trauma, particularly in childhood, can have long-lasting effects on both your mental and physical health. Trauma basically acts like a persistent stress alarm and holds our nervous systems hostage in the past. This chronic stress can then change how your brain works, mess with your genes, alter your behavior, and lead to chronic inflammation, all of which can contribute to chronic illness. Now, normally, if trauma gets resolved, our brains receive the message that we've successfully escaped a life-threatening or otherwise overwhelming event. Once that happens, the survival response shuts off and our nervous system returns to a healthy baseline. It's like being able to exhale after holding your breath for a while. But when trauma is left unresolved, it changes how our brain works because our brain thinks that we're still in that threatening situation. This not only keeps us in a heightened state of alert, but it also messes with our ability to accurately perceive danger in the present moment. So we end up seeing threats left, right, and center. So what's actually going on in our brain? Our amygdala, which is like your brain's alarm system, goes into overdrive, constantly triggering the stress response. This alarm tells your hypothalamus to pump out cortisol, your body's main stress hormone. While cortisol is great in short bursts, helps you react to immediate danger, or improves your productivity, chronic exposure to cortisol can wreak havoc on your body and cause chronic inflammation. Normally, inflammation is the body's way of fighting off infections and healing injuries, which is a good thing. But when it becomes chronic, it can start to damage healthy tissue. This is one way that unresolved trauma can lead to autoimmune diseases and other chronic conditions. Now, usually your prefrontal cortex steps in to calm things down, acting like the brakes on a car. But trauma can make this part of your brain underactive, so these brakes don't work as well. So the stress alarm keeps sounding, even when it shouldn't, which can lead to long-term changes in how your brain is wired. So the pathways in your brain that respond to danger end up becoming more dominant, whilst those involved in trust and safety fade into the background. In simple terms, the part of your brain that triggers the stress response is working overtime, while the part that's supposed to calm you down is taking a back seat. This imbalance not only affects how you feel, but it can also lead to behaviours that harm your health and make you more susceptible to chronic conditions. But the good news is that your brain isn't stuck this way forever. Thanks to something called neuroplasticity, which is the brain's ability to rewire itself, it's possible to reverse some of these changes. So just like trauma can reshape your brain to be more sensitive to stress, positive experiences and certain practices that we'll get into later can help you rewire it in a healthier way. Now, let's talk about how genetics fits into all of this. I'm sure you've heard people say, well, that condition runs in the family, so I guess it's inevitable. But this is just a common assumption. Whilst you might have a gene linked to a certain condition, that doesn't mean you're automatically destined to get it. Yes, genetics play a role, but whether you actually develop a condition often depends on how those genes interact with your environment and lifestyle. Take diabetes, for example. If it runs in your family, your risk is definitely higher. But whether you actually develop it depends on a lot of factors like what you eat, how active you are, and how you manage stress. In fact, studies have found that genetics are not the major causes of chronic diseases and carry less than 50% of the risk. And in 2019, Researchers at the University of Alberta did the largest meta-analysis ever on this topic, looking at 2 decades worth of data, and they found that most diseases, including diabetes, Alzheimer's, and various cancers, have a genetic contribution of only about 5 to 10% at most. This means that while genetics may play some role, they definitely don't determine your fate. Just think of your genes like a safety net. Some of us have stronger nets that catch us when we fall, whilst others have a more fragile one. You might know someone who's been through a lot of trauma, but seems to bounce back every time without any long-term effects, while someone else might have one tough experience and end up with chronic health issues. This brings us to epigenetics, which is all about how your life experiences can actually change the way that your genes are expressed, like flipping a switch on and off. Trauma can turn on genes that promote inflammation and turn off genes that protect against it, which can increase your risk of chronic diseases. Imagine your genes are like a set of light switches in a house. Depending on your experiences, certain lights might be turned on, while others remain or get switched off. But here's where it gets really interesting. These changes can actually be passed down to future generations. For example, research on Holocaust survivors found that their children and grandchildren had altered gene expression, higher stress hormone levels, and they were more prone to anxiety and depression, even though they didn't directly experience the Holocaust themselves. And this wasn't about the trauma being passed on through stories or grandparents' memories, but rather their bodies were primed to react as if they were under threat. It's like you inherit a house where certain lights were already switched on or off, but the silver lining is that you still have the ability to change it based on your own experiences. If trauma can turn those switches on, positive experiences can turn them off. And equally, if a parent had any protective or beneficial genes turned on, they may pass it along to their child in that healthy state as well. Now, genetics is just one piece of the puzzle. Your early life experiences, arguably a bigger piece of the puzzle, will also have a big impact on how vulnerable you are to developing a chronic condition. And the earlier in life you experience a trauma, the more it can affect your health because it shapes the development of your coping mechanisms, your attachment, and your personality. The adverse childhood experiences, or the ACE score, is one way that researchers have measured this. It looks at the number of negative experiences before the age of 18, so things like losing a parent to divorce, witnessing domestic violence, or having a parent with mental health issues. And the numbers are staggering. A huge study done in 2009 of over 15,000 people found that even if you have an ACE score of just 2, like me, say you lost a parent to divorce and had a parent with depression, your risk of being hospitalized with an autoimmune disease increases by 70%. But I want to stress something here. If you go and look up the ACE criteria and don't see your specific experiences reflected on there, it doesn't mean they don't matter or aren't valid. The ACE score is just one tool, but it doesn't cover everything, especially some of those other types of trauma we talked about earlier. Things like bullying or dealing with chronic illness in childhood aren't on that list, for example, but those can still have a lasting impact on your health. So there are many other tools like the Childhood Trauma Questionnaire or the Resilience Scale for adults, which look at a broader range of experiences and also take into account positive factors like social support and positive relationships, which can buffer the impact of trauma. Now, what about trauma in adulthood? Does it have the same impact as childhood trauma? The answer is yes, it can be just as significant, especially if it's severe or life-threatening trauma. Experiences like assault or losing a spouse can lead to PTSD and disrupt your life just as much as childhood trauma can. Whether it's childhood or adulthood trauma, the effects of it depend on a lot of factors: what you've been through, how long it lasted, and what kind of support you had at the time. And on top of the impact of these experiences on your brain and body, these experiences can also lead to unhealthy coping mechanisms like smoking, overeating, or substance abuse, or even more subtle changes like withdrawing and shutting down. These behaviours, combined with the body's heightened stress response, can increase the risk of developing chronic health conditions. So we've covered how trauma can lead to chronic conditions, but let's flip that around. Chronic conditions themselves can be traumatic, leading to what's known as medically induced PTSD. This can come from invasive procedures, surgeries that didn't go as planned, or repeated hospitalizations. Chronic conditions can also create what's called symptom-induced PTSD. It can already be exhausting dealing with the daily symptoms of a chronic condition. Add to that the constant fear and uncertainty of your symptoms flaring up, and your nervous system is kept in a state of chronic stress, worsening both your mental and physical health. It's a vicious cycle where the trauma from your condition worsens your health, which in turn causes more trauma. And it's estimated that about 12 to 25% of people who experience chronic or life-threatening illnesses develop this form of PTSD. It's even common enough that researchers have proposed a new model of PTSD called the Enduring Somatic Threat, or EST model, to account for the fact that chronic illness is not just past-oriented, but also poses an ongoing threat to your sense of safety and control. Now you might wonder, is this happening to me? So let's talk about the signs. Medically induced PTSD usually shows up in three main ways: re-experiencing, hypervigilance, and avoidance. Re-experiencing is when you find yourself back in that moment. Maybe you get anxious just driving by the hospital or before a simple doctor's visit. It could be that you've had a bad experience with a misdiagnosis, a painful procedure, or just felt totally dismissed by a medical professional. Those memories or sensations can play over and over in your mind, making it hard to move forward. You might also develop a deep mistrust of the medical system, which is something I've personally felt, where the system often feels like more of a hindrance than a help. Then there's hypervigilance. This might show up as an intense awareness of your bodily sensations. For example, I have Crohn's disease, and even if I feel the slightest twinge in my abdomen, I'm immediately on edge. I'm worried that it's the start of a massive flare-up and I'm about to relapse, and I get into a state of panic. Even though I've been in remission for years, that fear is still right there, because I still remember how debilitating it was before I got diagnosed and treated. And then there's avoidance. You might find yourself dodging anything that reminds you of your condition. Maybe you start skipping doctor's appointments or avoiding activities you used to love because they trigger your symptoms or bring back bad memories. This can lead to feeling disconnected from your body and developing a me versus my body mentality, almost like it's an enemy you're constantly fighting against. Living with a chronic condition can also mean grieving the life you thought you'd have. When people talk about a traumatic loss, it's usually about the loss of a loved one, but chronic conditions can also result in that same feeling. For me, being in my 20s, I pictured these years as my prime time, being full of adventure and socializing. Instead, I realized that that wasn't going to be my life, and I often felt trapped and held back by my own body. That sense of loss can be profound, and it's something many people with chronic conditions have to work through. So what can you do about medical trauma? The first step is recognizing that it is a real issue and that it deserves attention. You're not just dealing with a physical illness, there's a huge psychological component that's just as important. Working with your doctor or therapist to create a plan for dealing with these triggers or symptom flares can make a huge difference. It's all about finding ways to feel safer and more in control so that those PTSD symptoms start to ease. Now let's talk about something that's frustratingly common for many people dealing with chronic conditions, being told that your symptoms are all in your head. If you've ever been told that your symptoms are just stress-related or purely psychological, you know how invalidating that can feel. But let's set the record straight here. Yes, there's a link between trauma and chronic illness, but that doesn't mean that your illness is just a mental thing. Trauma causes real, measurable changes in your body's biology and the way your brain works. You're not imagining your symptoms, they're very real, and they deserve to be taken seriously and addressed by your healthcare providers. So how can you tell if you're traumatized or if you have unresolved trauma? It's not always easy to spot, especially since trauma doesn't always scream out for attention. It can be sneaky, showing up in ways you might not immediately recognize, like subtle changes in your behavior, how you see the world, or even in your physical health. One of the first clues is a shift in behavior. Maybe you've noticed you're more irritable lately, snapping at little things that wouldn't have bothered you before. Or perhaps you've started withdrawing from social activities, pulling away from friends, or stopped doing hobbies you used to enjoy. Your eating habits might have changed, or you might be experiencing depression and anxiety, which you didn't used to experience. Sometimes the people around you might notice these changes before you do. Another sign is if you've started seeing the world through a different lens. For example, you might have previously approached new people with curiosity or openness, whereas now you might approach people with suspicion or fear. You might find it harder to trust others, or you might react defensively in situations where you once felt safe. Trauma has a way of reshaping our perception, making us more guarded or anxious. And how can you tell if your trauma and chronic stress is starting to mess with your body? Is there an easy way to measure it? One way to find out is through a simple lab test that measures inflammation, specifically looking at something called CRP, so that stands for C-reactive protein. CRP levels rise when there's inflammation, like when you have an infection. But if your CRP stays high, even after you've recovered, it could be a sign of chronic inflammation, which we know is often due to stress and trauma. In fact, several studies have found that elevated CRP levels are closely linked with chronic stress and trauma. If you're already dealing with a chronic condition, you can start to identify your trauma triggers through symptom flares, and you may already be well aware of them. Triggers are essentially reminders of past trauma. So when you're exposed to a trigger, your body might react in ways that feel almost identical to how you felt during the original trauma. Things like a racing heart, sweaty palms, or that lump in your throat. In some cases, it can feel like you're reliving the trauma all over again. These triggers activate your body's fight, flight, or freeze response, the same one that kicked in when you first experienced the trauma. And every time you encounter a trigger, your sensitivity to future ones can increase, making your symptoms flare up even more. Spotting these triggers can be tricky because they're often buried deep in your subconscious. You might not even realize that a certain symptom flare was set off by a specific memory or experience from your past. Triggers can also be hard to spot because they may initially seem completely unrelated to your trauma. For example, if you grew up feeling neglected or unloved, you might find yourself reacting strongly to subtle reminders of that experience, like someone appearing disinterested in your conversation, a social setting that feels exclusive, or even a tone of voice that feels dismissive. These situations can bring up old feelings of rejection or inadequacy, causing your symptoms to spike. Recognizing these triggers is crucial. Once you know what sets them off, you can start working on ways to reduce their power over you and the trauma-related symptom flares. So can you recover from trauma? Recovery from trauma is absolutely possible. Our nervous systems are built to recover, and our brains can be rewired with the right support, resources, and time. Plenty of research backs this up. A study published in the Psychiatric Clinics of North America in 2019 showed that trauma-focused therapies can lead to significant reductions in PTSD symptoms and improve overall quality of life. While we can't erase the past, we can change how our minds and bodies respond to it. The goal is to process the trauma, find ways to feel calm, safe, and connected again, and maintain that even when triggers pop up. It's important to recognize that healing from trauma isn't a quick fix. Just like working out at the gym, you need to put in consistent effort in order to see changes. So how do you actually recover from trauma? Where do you even start? Let's talk about some strategies supported by research and practical experience. First up, let's talk about building positive relationships. Traumatized human beings recover in the context of relationships, whether it's with family, close friends, support groups like AA, veterans organizations, religious communities, or a therapist. Study after study shows that having a good support network isn't just a nice to have, it's one of the most powerful factors in preventing and healing trauma. Why? Because recovery doesn't happen in isolation. These connections create a safe space where you can share what happened to you without fear of shame or judgment. They provide a big part of the safety net you need to start facing and accepting those tough experiences. And it alleviates the emotional isolation that often comes with keeping those experiences inside. A more unexpected way to connect with others is through activities that involve rhythm and movement, like singing in a choir, dancing, or participating in a theatre group. When we engage in these activities together, we tap into a sense of joy and a sense of belonging. This can be especially healing if you've experienced any kind of attachment trauma, where that early parent-child bond might have been lacking. These kinds of playful group activities help to rebuild that sense of connection and attunement, which is so important for recovery. While activities like dancing or singing in a group can be really helpful, they're often not enough on their own when it comes to healing from trauma. Putting your experiences into words is one of the biggest and most crucial steps in recovery. It's natural to want to bury trauma deep inside, but staying silent only deepens the isolation and avoidance that trauma creates. But talking about it can actually help shift those memories from the non-verbal parts of the brain to the areas involved in language and understanding. This shift can reduce the emotional intensity of these memories, making them easier to process and heal from. When you talk about your trauma within a supportive relationship and you feel understood, it might be a therapist, a support group, or someone close to you, but it's like your brain starts to relax. It activates the emotional centers of your brain, helping to untangle those emotional knots. It's like a weight being lifted, and that sense of relief and connection is a huge part of healing. But sometimes words aren't easy. Maybe you struggle to put your feelings into words, or maybe the emotions are just too intense and overwhelming that they feel impossible to describe. This is where your body comes in. Your body holds on to trauma in ways you might not even be aware of, like tension, discomfort, or certain physical sensations. By tuning into these signals, you can start to understand what your body is telling you, even when your mind can't quite put it into words. You might find mindfulness to be really helpful here. Mindfulness is all about building self-awareness, really noticing what's going on inside without immediately reacting to it. It's normal to want to avoid certain sensations, like that tightness in your chest or the pit in your stomach, especially if the sensations are painful. But by avoiding these sensations, we actually make ourselves more vulnerable to being overwhelmed by them. Mindfulness helps you observe these sensations and the emotions that come with them, which gives you the space to choose how to respond instead of just reacting out of habit, for example, in the form of panic or pain or withdrawal. And the benefits of mindfulness are pretty impressive. Research shows it can help with everything from chronic pain to lowering blood pressure and even reducing cortisol levels, the stress hormone. Harvard Medical School also found that it helps to rewire the brain, decreasing activity in the amygdala, your brain's alarm system, and strengthening the prefrontal cortex, which is involved in your emotional regulation and calming the stress response. So practicing mindfulness can help calm your nervous system and make you less likely to get thrown into fight or flight mode in the face of any threats or triggers. Mindfulness can be practiced in countless ways, including meditation, journaling, breathing, and different forms of movement. One example of a mindful movement practice is yoga. Yoga teaches you to breathe and stay relaxed even when difficult emotions come up. This isn't just about stretching, it's about learning to be in the present. staying grounded and calm, which activates your prefrontal cortex, the part of your brain that helps regulate your emotions and your stress. Research backs up yoga's impact on trauma and chronic illness. A study published in the Journal of Clinical Psychology found that just 10 weeks of doing yoga for 1 hour a week significantly reduces symptoms associated with trauma disorders. Another study from Harvard Medical School found that yoga practice not only reduces symptoms of chronic illness, including chronic pain, but also enhances emotional resilience and brain function. Another plus is that yoga isn't an intense workout, which makes it an easy starting point for people with chronic conditions. And in fact, many doctors now recommend yoga as part of managing these conditions. But if yoga isn't your thing, that's okay. Whilst yoga is the most widely researched movement practice in this context, it's not the only one that can help recovery. Other practices from around the world, like Tai Chi, Taekwondo, Aikido, Jiu-Jitsu, Kendo, and Capoeira, also combine physical movement, breathing, and mindfulness, so they can also offer similar benefits for healing. A further step you might explore is through therapy that focuses on how your thoughts and physical sensations interact. This can help you understand how particular thoughts and emotions are registered in your body. For example, in my own therapy sessions, when I share something that deeply affected me, my therapist guides me to check in with my body at that moment. She'll ask things like, what's happening inside you as you talk about that memory? Where do you feel it? What does it feel like? From there, she helps me find a way to release that physical sensation, which I can then use whenever I encounter triggers that bring up the same feelings. This process also helps me quickly recognize triggers, often before I even consciously understand why something is affecting me, because it's much faster and easier to notice a physical sensation than to figure out the logic behind it. If this sounds like something you'd like to try, you'll want to look for a therapist who mentions techniques like emotional freedom techniques or EFT, somatic experiencing, or other mind-body therapies. These approaches are key in helping you connect the dots between your mental and physical states. And remember, it might take some time to find the right therapist, but it's really worth the effort. I went through 4 different therapists before finding one who worked for me, but finding the right one has been a game changer. Another therapy worth mentioning is EMDR, which stands for eye movement desensitization and reprocessing. It's a technique that helps your brain process traumatic memories in a new way, and the process involves following guided eye movements or bilateral tapping while recalling the traumatic event. This is meant to help the brain reprocess the memory and integrate it properly. And research shows that EMDR can significantly reduce PTSD symptoms, with studies like those in the Journal of Clinical Psychology showing improvements in 60 to 80% of patients after just a few sessions. Finally, let's touch on neurofeedback, a non-invasive therapy that uses EEG technology and feedback systems to help retrain your brain. Trauma can mess with your normal brainwave patterns, leading to unhealthy biological activity and behavior. So neurofeedback taps into neuroplasticity, the brain's ability to rewire itself, and helps to restore a more flexible and balanced state. During a neurofeedback session, you might watch a video while your brainwaves are tracked in real time. When your brainwaves shift into a more balanced state, like being calm and focused, you get positive feedback, which helps your brain learn healthier patterns over time. And research supports its effectiveness. For example, a study published in the Journal of Neuropathy found that 70% of participants experienced a significant reduction in PTSD symptoms after neurofeedback treatment. There are 2 types of neurofeedback, which are especially effective for trauma according to clinical research. They're ILF training and alpha theta training. Each of these focus on different brainwave patterns and are worth looking into if you go down this route. The beauty of neurofeedback is that it doesn't require you to talk about your trauma or consciously control your thoughts and emotions. It's all about letting your brain's natural plasticity take the lead in healing. And as you repeatedly train your brain to reach and maintain these healthy states, you'll start to find it easier to stay calm in stressful situations or in the face of any triggers. So there you have it, a variety of strategies that can help you on your journey to recover from trauma. If you're dealing with a chronic condition, you might be wondering, okay, but what if I do all of this and resolve my trauma? Can that reverse my condition? The short answer is it can definitely help, but it may not always result in a full reversal. Chronic conditions are complex and can be influenced by several factors, not only trauma. That said, resolving trauma can definitely have a significant impact. I've personally noticed that even though I have Crohn's disease, and that is considered lifelong, I've been in remission and without medication for a long time now with little to no symptoms. I wouldn't consider myself cured, as I still have to be very careful and diligent with things like diet, lifestyle, and stress management compared to the average person. But before addressing my trauma and chronic stress, I wasn't nearly in such a healthy position. Research backs this up as well. For example, a study published in the Journal of Trauma and Dissociation found that trauma-focused therapy not only reduced PTSD symptoms, but also improved physical health markers like reduced inflammation and better management of chronic conditions. And another study from Frontiers in Psychology showed that treating trauma led to noticeable improvements in chronic pain and other symptoms related to chronic illnesses. So ultimately, addressing trauma can be an incredibly valuable part of treating chronic conditions. As we wrap up today's episode on trauma and chronic illness, I hope this conversation has given you a clearer picture of just how connected our mental and physical health are and how deeply trauma can affect our bodies. If you're curious to dive even deeper into this topic, I highly recommend checking out the book The Body Keeps the Score. It's a game changer for understanding the mind-body connection. Now, we've covered a lot today, especially around different strategies to help you address trauma. It can be a lot to take in, so don't feel like you need to jump into everything all at once. Pick one thing that really speaks to you and start there. Make it a regular part of your routine, and once you feel comfortable, you can explore adding in more. If you found this episode helpful, please share it with someone who might benefit from it too. And if you enjoyed what you heard, leaving a review would mean the world to me. It helps others find the podcast and lets me know what's resonating with you. Don't forget to follow along for more insights into the link between psychology, neuroscience, and health. Thanks so much for listening to the Hidden Health Code. Take care and see you next time.